Hi, I'm Michelle Tompkins, and I'm here to talk about a Wellness Connection program we're bringing to you June 21st in the Social Center at 145. And joined with me today is Michelle Van Gorder from Avinity Home Care. She's an occupational therapist and a director of Avinity. Welcome, Michelle.
Thank you.
So the program you're going to be presenting is called Low Vision and You. Give us a brief background about the Low Vision program.
Sure. So in 2003, Medicare recognized low vision deficits as a therapeutic service that they would cover and provide. The reason being is it's third in prevalence behind arthritis and heart disease. Those who suffer from low vision they are twice as likely to fall. 2.9 million people in America suffer from low vision, and it's one of those diagnoses that by 2030 is projected to increase by 72%. It's very prevalent. The program is designed, low vision therapy is designed to treat low vision diagnosis, but it's also a program that is proactive for fall prevention.
Absolutely, and obviously we're talking about eyesight here.
Eyesight, correct.
And eyesight issues and eyesight problems, and when you talk about falls, that is such a concern with our population today, is being nervous about falls, scared and anticipating when that fall is going to happen, but it doesn't necessarily have to happen if you take a proactive step in especially your vision. So tell us some of these eyesight diagnoses that you see every day.
Okay, under low vision, the common diagnoses are macular degeneration, glaucoma, cataracts, diabetic retinopathy, retinitis pigmentosa, you name it, double vision, hemanopsia from strokes. Basically anything that would hinder your vision is something that would be covered under low vision services. When you think of all of those diagnoses, what they're seeing puts a big impact on their safety in falls. We look at depth perception, color, so all of the diagnoses each equally affect their safety and independence in the home.
Things that, say, someone like myself who's not trained in that area wouldn't look for necessarily.
Right, right.
So you mentioned falls and you mentioned Medicare that holds this program. What can a resident do who's out there watching today, or someone who might come to your presentation, if they're interested in taking advantage of that? How do they do that?
Well, we're having the talk on the 21st, which is going to be a great educational piece. We're going to do hands-on with some of the equipment. It will have our information there. It's 100% covered by Medicare. We offer home health services. It's getting in touch with a physician, getting a physician's order. We can help expedite that at all. And for me, really, I'm passionate about people just being aware of the service that's available to them. I think a lot of times just coming to talks and hearing the resources available, most people are interested in having an occupational therapist come into the home and discuss further what we can do.
That sounds wonderful. Creating that awareness for our resident safety and just further all over knowledge. So let's talk about some of these tools and resources that you brought for us today.
Sure.
Of course, you got the telephone. Tell us about a couple more.
Okay, so we do, part of coming in under the low vision services is we'll do a home safety assessment. We do adaptive equipment, which is this, recommendations and training. And so under the adaptive equipment, we look at things like, simply, if they're able to place a call. We can provide large dial telephones. This is also covered 100% by Medicare. The equipment we issue, there's no charge to the patient. So this is a large dial telephone. We have magnifiers. What we do is come in and we look at the magnifiers that people are using to make sure that the strength is appropriate for them, make sure they have the appropriate lighting. And we look at the lighting that they use in their home, making sure that they have it replaced with the new blue tint or purple tint bulbs because it replicates the daylight. The old type of bulbs are more of a yellow or off-white, and they blend colors. So just replacing things like proper lighting.
Now that right there is something I wouldn't even think of.
Right. And most of the time, that's the service I believe the occupational therapists can provide that's beneficial to the patient, because we go into the home and we look at it from a independence and a safety aspect, considering anything that low vision can affect. So it's typically lighting, glare, and magnification that we look at, contrast of colors, all of that stuff. If you don't have the proper lighting, the proper contrast of colors, that poses a fall risk for the patients. So we also, we work with all types of magnification. This is considered a handheld magnifier.
Wonderful.
We have people that like to read the newspaper. This is considered a hands-free magnifier.
Sure.
So it's a necklace that you put over, so you can you can actually do crafts under here, you can sew. So these are just a few of the examples we have. With the main diagnosis we see, like macular degeneration, glaucoma, the National Eye Institute puts out a book, and so we issue this to them. So it's a reference. It talks about like the foods to eat, vitamins to eat, if you're traveling, just all types of different resources. It's just a nice little handy Bible for them to carry around for their visual deficit.
Well, thank you for being here with me today. We'll look
Thank
forward
you.
to seeing you on June 21st over in the Social Center at 145.
Absolutely.
For everyone out there watching, please, if you're interested and maybe interested for a loved one or friend, family member, please sign up at your service desk. We'd love to have you there. Thanks, Michelle. We'll see you then.
Thank you.
Have a good one.
You too.